Hi, we are going over chapter 8 today, which is embryology and histology. So for chapter 8, we start off with embryology, the definition, which embryology is the study of formation and development of an embryo and fetus. Histology, the definition, is the study of structure and function of tissues on a microscopic level. With prenatal development, prenatal development is a process of growth and development within the womb throughout the stages before birth. So, germinal period is the first 2 weeks, and then they move into the embryonic period. That's the 3rd week to the 8th week. And at this time, the developing life is known as an embryo. It's the most critical time in development, and you need to know that. After that, the fetal period begins. That's during the 9th week and lasts until birth. Because all the organ systems are forming during the embryonic period, the fetus is less vulnerable than in the embryonic period to malformations caused by radiation, viruses, and drugs. So during the embryonic development, we're going to talk about embryonic development of the face and the oral cavity. So by the 3rd week of development, 3 embryonic layers are formed. The ectoderm, that's going to form skin, the brain, spinal cord, hair, nails, tooth enamel, lining of the oral cavity. The mesoderm layer will form bones, muscles, circulatory system, kidneys, ducts, reproductive system, and the lining of the abdominal cavity, along with dentin, pulp, and the cementum of the teeth. In the endoderm layer, that will form the lining of the digestive system, lining of the lungs, and parts of the urogenial system. In the 4th week of embryonic development, the heart begins beating. In the 4th week, the stomodendum, or the primitive mouth, and the primitive pharynx emerge, and the stomodendum develops into part of the mouth. By the 5th week, the embryo is approximately 5 millimeters long, and the heart is prominent and bulging. If you look at figures 8.4 in your book, you can see the embryo at the 4th week of prenatal development showing the developing brain, the forming face from the growth of the frontonasal process with its stomodendum and placids, and the developing heart. With the first branchial arch, the Meckel's cartilage forms the mandibular arch, or the lower jaw. Bones, muscles, and nerves of the face, the lower lip, and the muscles of mastication forms. The second branchial arch, the hyoid arch, forms the styloid process, stapes of the ear, the stylohyoid ligament, part of the hyoid bone, part of the neck, and some muscles of mastication. And the third branchial arch forms the body of the hyoid and posterior tongue. Other branchial arches form the structures of the lower throat. So the palate is formed from 2 separate embryonic structures. We have a primary palate and a secondary palate. If there's any disruption in that process of them forming, it can result in a cleft lip or a cleft palate, which is a hole or an opening in their lip or their palate, which can make speaking or eating very difficult and could even require surgery for repair. So there are 3 stages in the development of the hard and soft palates. They have the primary palate formation, secondary palate formation, and fusion of the palate. So the process begins in the 5th week of prenatal development, and the bones continue to fuse and they're no longer visible once it is the full adult palate. With prenatal facial development, the development of the human face occurs chiefly between the 5th and 8th weeks. At 1 month, the forehead is the dominant feature, and at 4 months, the face looks human. The hard and soft palates are beginning to form, and the primary dentition has begun. During the last trimester, fat is laid down in the cheeks in what is known as sucking pads. So they give full, healthy term fetuses the characteristics of a round contour face, having these sucking pads laid down. Now, when we get into tooth formation, or odontogenesis is what it's called, it begins with the primary or baby teeth at the 5th week of the embryonic period. So there are 6 stages of tooth development, 4 in utero and 2 after birth. So we have initiation, the bud, cap, bell, apposition, and eruption stage. So in these stages, in the initiation stage starts with the formation of the dental lamina, which is thickened band of oral epithelium that follows the curve of the tooth in each developing dental arch. Almost as soon as the dental lamina is formed, it produces 10 enlargements of each arch. And the bud stage is the beginning of tooth development for each tooth. This stage follows a definite pattern and it takes place at a different time for each type of tooth. Almost as soon as the dental lamina is formed, it produces 10 round structures in each arch, signifying the bud stage of tooth development to become the primary teeth. In the cap stage, the cells of the tooth grow and increase in number. This growth causes changes in size and proportion of the developing tooth, and the tooth bud changes into a hollow cap-like shape. The ectoderm layer forms the enamel of the developing tooth, and the mesoderm layer, known as the menchyme, become the dental papilla, which forms the pulp and the dentin of the tooth. As the tooth develops, the menchyme surrounds it, condenses to form a capsule-like structure called the dental sac. This sac will give rise to the cementum and the periodontal ligament. And then it will go into the bell stage. The cells differentiate and become more specialized. As the tooth continues to develop, the dental organ continues to change. It assumes a shape described as resembling a bell. As these developments take place, the dental lamina, which thus far has connected the dental organ to the oral epithelium, breaks apart. The basic shape and relative size of each tooth are established during the process. This process starts at the top of the tooth and moves downward toward the future root. In the apposition stage, the epidermal tissue of the enamel organ and the dental papilla and the dental sac begin producing enamel, dentin, and cementum. And in the eruption stage, the 2 outer layers of the tooth are forming and the root in the canal forms. Dental tissues fully mineralize to their mature levels. Once the crown and root of a tooth have developed, the tooth moves vertically toward the oral cavity to erupt. With developmental abnormalities, we can have disturbances at any stage of dental development that can cause a wide variety of abnormalities. They can either be caused by genetic or congenital factors. If it's genetic, it is something that is caused by something that has happened through their genes. If that has been passed on from their parents. If it is congenital, it's meant something from birth that happened since birth. So in congenital factors, in prenatal tooth development, a genetic factor is most often a concern like their tooth size or their jaw size. Like maybe they got their dad's big teeth and their mom's small jaws. So that could be a genetic factor. A congenital factor could be a structural abnormality, a functional abnormality, or an environmental abnormality. So maybe they're missing 2 teeth congenitally, meaning they were born without them. That would be a congenital abnormality. Orofacial development after birth there is a considerable change in the shape of the face from that of the newborn to that of an adult. That's because the bones grow and are reshaped to achieve normal growth and development of the face. That process involves the laying down of new bones in some areas and the removal of existing bones from others. So you can see, if you look at pictures from a newborn even through 5 years old, you can see the big changes that they've had in their face over time. With eruption of teeth, eruption is the movement of the tooth into its functional position in the oral cavity, and you need to know that. Eruption of the primary dentition takes place in chronological order, and as does the permanent dentition later. So they all come in a certain order. Active eruption of primary teeth has many stages in the movement of the tooth. Shedding or exfoliation is the normal process by which those primary teeth are lost. So when a child loses their baby tooth, it is called shedding or exfoliation. And that's the process by which their normal baby teeth are lost. And then eruption is when the adult or primary tooth even erupts into the mouth, into its functional space. The process of eruption for a succedaneous tooth is the same for a primary tooth. So the word succedaneous means replacement of a primary tooth. So not all adult teeth are succedaneous teeth. Only the permanent teeth that replace primary teeth are succedaneous. So there should be 20 succedaneous permanent teeth that replace the 20 baby teeth or primary teeth. The permanent tooth erupts into the oral cavity in a position lingual to the roots of the shedding primary anterior tooth, or between the roots of the shedding primary posterior tooth. So what they mean by that is that for the anterior teeth, when they come in behind the baby teeth, and that is normal. And then they push forward and they resorb the root of the baby tooth. So they kind of like knock that root out and make it disappear. And then the tooth becomes loose and falls out. And then even though the adult tooth is positioned behind the baby tooth more lingually, the tongue will naturally push it into position. So oftentimes you'll have a parent bring their child in and say, something's wrong. Their adult tooth is coming in and their baby tooth is still there. So they have 2 rows of teeth essentially. And that is okay. Typically what happens is the adult tooth will resorb the root and the baby tooth will become loose and then they fall out and the adult tooth will move into position. Sometimes it does not resorb the root though, and the baby tooth stays in position and the adult tooth erupts fully into the mouth. In those cases, the baby tooth or the primary tooth has to be extracted. And then once it's extracted, the permanent tooth will move into position. Those are for anterior teeth. For posterior teeth, primary tooth is there and the permanent tooth starts to erupt between the roots. So it resorbs the roots. So then just the crown of the tooth is there. The tooth becomes loose, falls out, and then the permanent tooth erupts into place. Again, sometimes that doesn't happen as it's intended to, and it does come in, the permanent tooth comes into the lingual or the buccal side of the tooth, and the primary tooth stays in place and doesn't get loose. If that does happen, then the primary tooth has to be extracted. With histology, it's the study of the structure of function of the teeth and oral tissues. It concerns anatomical parts of the histology of the teeth the supporting structures, the oral mucosa, which surrounds the teeth and lines the mouth. A crown. Each tooth consists of a crown and one or more roots. In the crown, dentin is covered by enamel, and in each root, dentin is covered by cementum. So dentin is the bulk of the tooth, and it's covered by a thin layer of enamel on the crown of the tooth. On the root of the tooth, it's covered by a thin layer of cementum. So the enamel is the strongest mineral substance in the body, and it helps to protect the tooth from cracks, breaks, decay, things like that, acid. The enamel or the cementum helps to attach the tooth to the alveolar socket. The inner portion of the dentin of both the crown and root also covers the pulp cavity of the tooth close to the cemento-enamel junction. So the pulp covers up what's even deeper inside the tooth, which is the pulp chamber in the crown and the roots or the pulp roots inside of the tooth, the nerve chambers, which where what houses the nerves for the tooth and the blood supply. The cemento-enamel junction is where the cementum and the enamel meet. An anatomical crown is the portion of the tooth that is covered with enamel. The clinical crown is the portion of the tooth that is visible in the mouth. So they might seem like the same thing, but when the tooth erupts naturally into the mouth, that whole crown is covered in enamel. But and that whole crown is both the clinical and anatomical crown. As we age, we have recession, and the gums will start to recede and the tooth will start to look longer. In that recession area, we will not have enamel covering the part of the root that is exposed. However, the anatomical crown will stay the same. Only the portion of the crown that is covered in enamel is the anatomical crown. But now you can see more of the tooth in the mouth. So the clinical crown is always the whole part of the tooth that you can see in the mouth. But the anatomical crown is only what is covered in enamel. The root of the tooth is the portion normally embedded in the alveolar process or the jawbone, and it's covered with cementum. So depending on the type of tooth, it may have 1, 2, or 3 roots. The tapered end of each root is known as the apex, or the tip of the root. Each root is going to have its own apex. And at the tip of the apex is going to be a small opening or a hole that is called the foramen, and that is how the nerves leave the tooth and enter the jawbone so that the blood supply can get to the tooth and it can be fed and innervated. For tooth tissue, enamel makes up the anatomical crown of the tooth. Like I said, it's the hardest material in the body. It's very strong but brittle and can fracture easily. So this has some other stats about enamel on this slide. With dentin, it's bone-like, rigid connective, let me go back to dentin. With dentin, makes up the main portion of the tooth structure, extends almost the entire length of the tooth, and it's covered by enamel on the crown and cementum on the root. We have primary, secondary, and reparative dentin. For cementum, it's bone-like, rigid connective tissue that covers the roots of the teeth only. It lies over dentin and joins the enamel at the cemento-enamel junction, or the CEJ. Its primary function is to anchor the tooth to the bony socket with attachment fibers within the periodontium. The pulp is made of blood vessels and nerves that enter the pulp chamber through the apical foramen. The bloody supply is derived from branches of dental arteries from the periodontal ligament. The coronal pulp is in the crown of the tooth, and the radicular pulp is in the nerves or in the roots of the teeth. The periodontium is the supporting structure for the teeth. It's within the alveolar bone, and it consists of cementum, alveolar bone, the periodontal ligament, and the gingival unit. These tissues protect and nourish the teeth. The alveolar process supports the teeth in their functional positions in the jaw. It's what holds the teeth in place. There's something in it called a cortical plate, and it's a dense outer covering of the spongy bone that makes up the central part of the alveolar process. The alveolar crest is the highest point of the alveolar ridge. So when you look at a bone and you see that point at the top of the jawbone where you see that the teeth are sitting, that point in the top where the teeth are together is the alveolar crest. The alveolar socket is the cavity that the tooth sits in, and the lamina dura is the thin layer of compact bone lining the alveolar socket. Our periodontal ligament is made of dense connective tissue organized into fiber groups that connect the cementum covering the root of the tooth with the alveolar bone of the socket wall. And its primary functions are to support and protect sensory, nutritive, and formative, and resorptive. These are the fiber groups for the periodontal ligament. And you can refer to figure 823 to see how they run in different directions. And with the gingival unit, the oral mucosa almost continuously lines the oral cavity. There are three main types of oral mucosa in the oral cavity. There's lining mucosa, masticory mucosa, and specialized mucosa. So be sure that you are studying each of these terms so that you understand the different types of mucosa and the different types of tissues that are involved in each tooth. Thank you.